Here we are. Hey you guys, this is just a quick run through of the scenario that you've taken part in the prompt. So when you come to the maternal collapse, you open the door and you found that you had someone here. So the first thing we can do is we should actually do our kind of a scene assessment to make sure it's safe. So things like making sure the lift stop is done, making sure it's not going to go anywhere, them kind of things. We're then going to approach our patient and we're going to go through our AVPA. Remember response, alert. Hello, my name's Jason, I'm a student midwife. So we should all do that in the NHS. Hello, my name is, give them your name, give them your grade. So we're going to go through that. They're not alert, so we go into voice. So it should come down, give them a command, open your eyes. So a nice command, so they're not alert, they're not responding to voice. The next thing we're going to do is any pain stimulus. I'm just going to tap you on the shoulders just to see if there's any response. This patient is unresponsive. I'm now going to do a shout for help. Help, can anyone help me in the lift area? Or if I've got someone, put them on standby because we might ask them to phone for an ambulance in a minute. The next thing I'm going to do is go through my ABC. So it's going to be airway first. So I'm going to do a head tilt and a chin lift. So I've opened the airway. Now I'm going to go into B to assess for breathing, to see if they're breathing at all, whilst keeping the airway open. This patient is not breathing. Lucy, please could you phone for an ambulance, dial 999, ask for a ambulance because we've got an unconscious, non-breathing patient, and can you make sure you told me when you've made that phone call, and I need you to go and find an AED for me, please. Can you come back and do that for me?
Yes.
Thank you. Whilst Lucy's doing that, I'm going to look at moving the patient. I'm going to use the advantage that the patient is slumped, sat up. If they were laid down, it would be harder. So while they're slumped, sat up, I'm going to try and come behind them, use good manual handling, looking after my back, and with their knees kind of bent, I'm going to come behind them and almost see if I can turn them in this area, and I might be able to. I can bring them out. I've now got 360-degree access. I could reassess. So there's my head tilt, chin lift, come down, look, listen and feel for up to 10 seconds for breathing. They're not breathing, so I'm going to start chest compressions. 2, 3. And then my AED arrives. As soon as my AED arrives, I'm going to switch it on. So I get it talking to me. The lid can be used underneath to help the airway to open up. We need to get a bare chest. The bra has to come off. There's jewellery, we need to get it out the way or take it off. There's a nipple piercing, we need to get it out the way and move it. I'm now going to get these pads and attach them to the patient. So this pad has to come all the way around the side, under the left armpit, under the left breast. This other pad will come all the way near the collarbone, up the top there. I'm then going to listen to what the AED says.
Don't touch patient, analyze it. Don't touch patient, analyze it. Shock advised.
So we're going to be shocking.
Don't touch patient. Press flat.
So everyone clear, top, middle, bottom, shock the patient, straight back on the
Start
chest.
CPR.
4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 2, 3, 4, 5, 6, 7, 28, 29, 30. If I was prepared to, I could now do 2 ventilations. If I'm not prepared to, I can do continuous chest compressions. Because this is a maternal collapse, I would also like to do left lateral displacement. Ideally, I would have somebody who can be here to do manual displacement of the uterus over to the left to get the weight of the fetus off of the vena cava. I haven't got anyone, but I have got a blanket, so I could do a left lateral tilt just to help, and then I can carry on doing my chest compressions as best as I can until further help arrives. This AED will reanalyse every 2 minutes, and I will stop chest compressions to listen, and I will press the button if it tells me to. So I hope that is just held a little run through of the scenario you dealt with in prompt, and just giving you a couple of ideas of how to follow that algorithm. So make sure you check for any safety issues. Go through your response, your AVPU, alert, voice, pain, unresponsive. Go through your ABCs. Open the airway, check for breathing. If not breathing, start chest compressions. Get the defib on as early as you can. Any questions, send me an email.